Hi everyone, my name is Alex, and today I wanted to make a video going through all of the tools and gadgets that I've used over the past few years during my road to recovery with upper cervical cranial instability. So just as a quick recap, I have been a patient at Regenix and have gotten multiple PICL stem cell procedures. So all of the tools that I'm going to show you I actually pretty rarely use nowadays. Like maybe I'll use one of them every few weeks, like every 2 weeks, and sort of momentarily. But these are all things that I used very frequently, like daily. And I used a lot of different things over the years trying to figure out what was going to work best for my neck to reduce my symptoms. And my symptoms were primarily neurological, so brain fog, vertigo, dizziness, but also my neck was very tight, in particular my sternocleidomastoid, so that's basically what connects here down to here. So every body is different, every neck is different, and you're just going to have to find and experiment what works best for you. But let's hop into it. So the first item that I actually didn't think about, maybe because it's so obvious to me, I didn't bring it up here to show you, is my pillow. So I have tried probably half a dozen pillows over the year, and as I've gotten more PICL procedures and my neck has strengthened and tightened, the sort of pillow that works best for me has actually changed. So just keep in mind that if you are undergoing stem cell therapy or other sort of treatments, as your neck structure and anatomy changes, as the ligaments tighten, it's very likely that what you're going to need with respect to a pillow is going to change. And it's not just your pillow, but also your bed. But I think the pillow is much more important, at least for me, than the bed. And just think about it. If you are sleeping 7, 8, 9 hours a night and you're laying in the same position, how your head is positioned is so important because you're spending so much time there. There are a lot of people that talk about belly sleeping and how you should be sleeping when you are on your bed, particularly if you have a neck injury. And I can tell you that you can kind of encourage how you want to sleep, but your body is just going to go into whatever position it thinks is best. So a few years ago, when my neck was a total disaster, the worse my symptoms were, the more I would sleep on my stomach with my head turned to the right. And so I just finally realized after a while that sleeping on my stomach wasn't making the problem worse. In fact, I was sleeping on my stomach and turning my head because my body wanted to have my head in that position for some reason. And as I have gotten better and better, I started sleeping on my side, on my left, so I was still having that sort of pressure with my head turned to the right, and then I went to sleeping on my back. And now I sleep on my back, but my head is still turned to the right. So it's much more gentle than if I was sleeping on my stomach. But there's something there where the body is going to move into whatever position it thinks is best. Now, if I travel without my pillow and it's like I hope I never lose this pillow because if I do we're gonna have some major problems. I hope they still make this pillow. I don't even know who made it, but if I travel, say, to the United States, I have to bring my pillow with me in my luggage. And actually I was just in the US back in January and I was up there for like 2.5 weeks and I just didn't have room in my luggage. And I said, you know what, my neck is pretty good. I wonder what it will be like to not sleep with my pillow. And I was in 3 different hotels and Airbnbs over a 2.5 week period, different beds, different pillows. My neck's been pretty good for the past year, but that gave me a flare up of symptoms that I haven't had in a very long time for about a month. So if you have a pillow, travel with your pillow, buy 3 of them so that you have them in storage in case something goes wrong. Okay, so second item here is a infrared heating pad, and this one is made by Thermotex. So infrared heating pads, this one's got dog hair all over it, but infrared heating pads are very different from normal heating pads. So normal heating pads are just going to penetrate the highest level of the skin. It's not actually going to penetrate down deep into the muscle. So an infrared heating pad, and this is the best company out there. It's not cheap. I think this was like 120 bucks, which is really expensive considering that normal heating pads are like $20. This is going to penetrate like 1 or 2 inches into the muscle. And what it's going to do is it's going to help with blood flow into the area and make it easier for you to stretch the muscle and also just help it if it's inflamed for any reason. This heating pad is really good for the upper trapezius and maybe lower neck. It's a little bit more difficult to use in the suboccipitals, but you can get it there if you're tricky. The infrared heating pads they're made a little differently. They have these panels, and these panels are sort of rigid, so you have to be a little not careful, but intentional about where you're placing it on the muscle. Nowadays, I really just use it after I'm exercising and my muscles just tight from uh, strength training. So I use it the most on my hips nowadays, but it was really, really good for when my traps were tight. Next item here is something that I think a lot of people don't know about, and it was a huge, huge blessing for me. I had a physical therapist that put this on me, and I was like, what the hell? This is magical tape. So this is athletic tape, okay? And athletic tape is sort of like stretchy duct tape that sticks to your skin, and it's used a lot with sports injuries. And it's used to bring stability to a joint, for example. And I loved it when my physical therapist put this on my neck, and I decided to just get it myself. So a roll of this is like 15 bucks. It'll last you a long time. You'll probably need someone else's help to put it on, and you'll definitely want to watch videos and look at a picture on how to put it on you, and you'll have to experiment. So for me personally, we would cut this into two, and then I would have 4 strips basically. So I would have a strip running from here to here and here to here. So basically down both branches of the SCM, and then one, I would have to sort of shave my neck here to get rid of this hair, and then it would be running here down to like the first rib on both sides. So that brought a lot of stability to my thoracic region and also to my SCM. And this was something where if I was very flared up, I would put it on, and within a matter of 30 minutes, all of my symptoms would be gone. Now, this is not a great long-term solution, because if you're stabilizing a joint or reinforcing a muscle with stuff like this, the muscle's just going to get weaker, and it's not going to be a permanent fix. But this is the magical solution that I think a lot of people don't really realize can help them a lot. And also, it just looks kind of cool. I think it looks cool. It's like, I look like an athlete. Okay, next up. This is my Miami J collar. So I only wear this now when I'm exercising, when I'm on my Peloton, on my bike. I went a long time without having a cervical collar. There's two out there. There's the Aspen Vista and the Miami J that are really popular with patients that have upper cervical instability. I got a prescription. I went to I forget the technical term for it, orthopedist? I don't remember. But I went and they showed me like 6 different collars, and I tried all of them all on. And there was one collar that was like really, really good, but it was such a pain in the ass to put on. And I just said, I like this one the most, but I'm never going to have the dedication to put it on and take it off and do it properly. This one got me like 80% of the way there, and it's so easy to put on and take off. So I'm really glad that I got it. The Miami J, it's really easy. So there's these 2 branches here. I just unclip it, stick it in like this, make sure it's nice and tight on both sides, and I'm ready to go. When it comes to exercising. I don't think it's on straight, but you get the idea. I'm ready to go to exercise. I will wear this sometimes for some exercises when I'm strength training. So anything that will use sort of anything that could flare up my neck, I will wear this today. Um, so obviously I work out at home because I would get a lot of raised eyebrows if I was exercising when I'm wearing this. It looks a lot more intense than it actually feels, I think, and I think I was resistant at first to wear something like this because I thought it was too extreme. But then once when I put it on, like if you have upper cervical instability and you put on a hard collar like this, you're going to feel normal pretty quickly. And then when you take it off, you'll be like, oh, damn, reality is hitting me in the face. And so I really love and appreciate this. Also, the pads on the Miami J, they're removable and machine washable. This one is definitely drenched in sweat and super gross because I only use it when I exercise. You need to get fitted. And if you can't get fitted, then get multiple sizes because the sizing is so important. There's a lot of doctors, cough cough Regenix, that are very against wearing cervical braces. I think it's short-sighted. I think it's stupid. I think that cervical collars are a huge, huge blessing for all of us to have upper cervical instability. And I would not have been able to exercise for a solid year and a half when I was recovering. Um, During my PICLs if it wasn't for having a collar like that. So, I mean, what would you rather have a patient do? Like potentially uh, have some weaker muscles or just not exercise for full time? The biggest risk with wearing a collar like that is if you start wearing the collar nonstop 24/7. I only wear it when I'm exercising because if I am exercising really hard, and I don't even wear it for all my exercise, I just do it for exercises that I know are going to flare me up. It used to be that I'd wear it a lot more. On that note, this is a hard collar. There's also soft collars. I know a lot of people that wear soft collars when they go to bed. It's obviously a lot easier to sleep in a soft collar compared to a hard one. You can get a soft collar from Amazon for like 10 or 15 bucks. Sleeping in a soft collar supposedly helps a lot with a lot of people, so try it out. Okay, next up. This is one that whoops, my box dropped. So this is one that I use a lot even today. It is a massager, wireless, handheld. Invest in a good wireless handheld massager. You will not be upset. I've bought multiple massagers over the years. You have to find one that is a really good balance of power and intensity and vibration speed because there's a lot of massagers that are a slower RPM but a lot harder and faster, and that's like too violent on the upper cervical, I think. What you're really looking for is something that is like medium pressure, high intensity, because that's what's really going to help loosen up the muscles. So this one, turn it on. It'll last a few hours. I love it. I have one in my office. I have one at home. And for me in particular, I use this, actually a few times a week just for a few seconds, especially after exercising. And I will put it up in here and just sort of massage the suboccipitals and just the SCM. It feels really good. I love it. It's good for massaging other parts of the body too, but for me, I mean, this is great. And it doesn't feel too intense and it doesn't feel like it's hurting anything. Now, I have another massager, for example, that is not really built for the neck. It's built for like deep trigger point issues in like the hips and the legs and the calves and things like that. If I put that on my neck, like it's going to cause some damage because it's basically uh, a, a recreated power tool. Like they repurposed a power tool for that thing, and you don't want to use that in your neck. Okay, next up. This is a hard foam craniocervical, suboccipital trigger point release tool. And the company who makes this, because I've tried a lot of these, and this is the one. Oh, damn it, I don't have the name. But if you look up suboccipital foam release tool, you will see one that looks like this. And there's one company that makes these for physical therapists. I used this at a physical therapy session and I loved it and I bought one immediately. It's really hard. So like this is me, I'm like squeezing it. As you can tell, I like can't squeeze it. It's really hard foam. It's it's hard. Like you can beat someone with it and they will not like it, right? So here's the deal. These little grooves, they fit on the bottom of your suboccipitals. So I don't know if I can show you, but you would put this on the ground and you'd lay on it, and then you would have your suboccipitals just be right there. And then what I do whenever I'm flared up is I will just very, very gently sort of tilt my head, do like an up and down, yes, maybe a small amount of side to side, and you will feel a trigger point that's really, really deep in the suboccipital region, likely somewhere. And just laying on it, finding the spot, laying on it, very gently sort of moving your head. You don't want to use too much pressure, but this is a really good way to self-massage and self-release the trigger points. This is not as effective as dry needling, which is where they stick the needles into you to release a muscle, obviously, because we're not sticking needles into ourselves, but it's pretty close. Like if you spend 10-15 minutes laying on this thing, you'll get pretty close to having a dry needling session in your suboccipitals. Okay, last up, I refer to it as my dinner roll. It's not a dinner roll, it's a Dena roll. Dena roll. So the Dena roll is a cervical curve restoration tool. Strongly recommend if you're going to use this to work with a chiropractor because they'll be able to size and fit you correctly. Having cervical curve restoration is really important for us because the more curvy your neck, the less impact and pressure there will be on your upper cervical. So you really can't go wrong using a tool like this for 5, 10, 15 minutes a day. Um, Work with a chiropractor on that. So, okay, those are all of my tools. Day to day, I mean, or let's say week to week, I would say I use this like 1 or 2 times a week or anytime I exercise before and after. And this is just like a good maintenance tool so I don't have any issues. I'll use this maybe once a month for 5 or 10 minutes. Um, and then I'll use this when I exercise. But that's really it. And so I chat with a lot of patients who are just realizing that they have upper cervical instability and they ask me like, what have I done? And so I wanted to make a video walking through everything. One, to help people, and two, so I don't answer the same questions over and over again, so I can just send you this video. So, okay. Oh, by the way, all of these tools are kind of pointless if you do not have good posture. And if you work at a desk, you really need to make sure that where your monitors are sitting, how you're sitting, the desk, the keyboard, the mouse, everything is as good as possible for your spinal and neck alignment. So I'm going to make a whole other video probably about this in my office likely. I don't spend a lot of time at this computer, so this is just like a normal chair, but I have a different chair for when I'm at work. I have a standing desk. I have a whole monitor set up. It's a whole situation, and you really, if you work at a desk, you really ought to invest in your health and get something like that. But you can use all the fancy gadgets and tools all you like, but if the core aspects of your posture are not being dealt with, I think that's your desk setup and your bed and your pillow, then all of it's going to be a waste of time. So, okay, I hope this helps someone. Good luck and see you around.